Good afternoon and welcome to our Lunch and Learn this afternoon. My name's Emma and I'm the head of Tram House School.
And I'm Kerry, I'm one of the outreach consultants.
And this afternoon we are going to be doing a presentation on mental health and autism. We are coming to you from Tram House School, so if you do hear a little bit of background noise, that's probably one of our learners on site. It's absolutely fantastic to see so many of you joining us today, and do put your name and where you're listening in from in the chat. We are recording this session as well, so we'll send that out by email at the end of the event. Please drop any comments or questions in the chat function and we will get to those either at the end of the presentation, or if not, we'll follow up by an email later next week. I am now going to hand over to Carrie, who is going to talk you through the first part of our presentation.
Bear with us. Sorry. Okay, so we're covering the definition of what autism is. We're going to be discussing some of the co-occurring conditions and then talking a little bit about trauma-informed practice. I will be discussing strategies within mainstream schools. Emma will discuss the strategies she's implemented at Tram House School, and then we will finish off with person-centered planning. Okay, so just a little bit about autism, click again. So the first characteristic is around persistent difficulties with social communication needs and interactions. And the second is around repetitive patterns of behavior, activities or interests. So taking into consideration this definition from the DSM, we'll go into some of the co-occurring conditions with autism on our next slide. So these are just some conditions that fall under the umbrella of neurodiversity. If we think about the impact on mental health and well-being, if an individual does already struggle with sleeping disorders, you can see how inadequate sleep would lead to poor mental health. Similarly, if they have a diagnosis of sensory processing disorder, it may mean that they find environments overwhelming, maybe overstimulating. Going into anxiety disorders and the branches from that around obsessive compulsive disorder, there may be events or situations that do cause quite excessive worrying, ruminations, and also that might lead to behaviors where the individual engages in quite routine or ritualistic behaviors. And then finally, around depression, if an individual is already struggling with low mood and doesn't have the drive to participate in activities that they used to find quite fulfilling, then of course mental health will be impacted there. We'll go on to the next slide. So just discussing about distress. Distress can manifest both internally and externally. So this might appear quite inward, so anxiety and depression. Your individual might become quite withdrawn. They might engage in, let's say, some self-harm behaviors or even eating disorders. And then on the externalizing distress, we've also got physical behaviors that might be towards others or the environment. And research just there highlights that autistic women and girls are more likely to engage in internalizing distress, whereas men and boys might present more external. So this is where you might have more physical behaviors. Okay, sorry, bear with me.
Okay, I'm going to talk a little bit now about trauma-informed practice. So this year at Tram House School, we have begun to focus more on a trauma-informed approach, including compassionate behaviour analysis, assent and assent withdrawal, ensuring pupils are happy and relaxed and engaged before they're able to access their learning, and generally focusing on positive relationships we form with our children in order to break down their barriers. Many of our pupils come to us having had failed placement breakdowns, which is one of the main motivating reasons for us to move towards a more trauma-informed practice. So first of all, I'm just going to introduce adverse childhood experiences. So we have trained our staff on the range of adverse childhood experiences our pupils could have experienced in their early childhood. On the slide, you'll see a range of ACEs, as they are commonly known, and as a school we have adopted or looked to adopt our sort of admissions process so that we can start to understand a little bit better about the early formative years of our children and young people before they enter our school. We've also discussed and trained our staff on the fact that due to our pupils' needs, they would have additional barriers in being able to communicate any of those experiences that they have been through. So we have to become more attuned to analysing the behaviour and what the behaviour is communicating to us. In terms of the impact that ACEs can have, we know through at least one study that an increased risk of children with ACEs does have an impact on both their both increased risks of health issues as well as having a negative impact on attendance rates at school, which as educational practitioners we understand that then that impacts later in life on achievement and life outcomes. We have also discuss with our staff the fact that ACEs, if someone is coming to us with 4 or more ACEs, it can lead to having an overactive stress response system. So that means that for our children and young people, they might see something which we might consider as quite minor, for example, running out of milk in the morning, and they might see that as a major and emergency. And as Carrie has already referenced around like externalizing behavior, that might be reflected in some of the behaviors that emerge from having that response to something which we would consider quite minor. The good news is that there are a number of protective factors that we can put in place to mitigate against ACEs. And if you look at these protective factors sort of strategically and sort of like within an overview and looking at the themes that emerge, these are largely centered around building positive relationships with safe adults. So for example, being well nurtured, being accepted, being shown affection. And other protective factors that are linked to their external support systems, for example, social connections that they form outside of school in the wider community, having good access to healthcare and specific services in a timely manner. And also having resilience modeled to them, which we do understand is not always easy, but having role models that can deal with stresses and who can bounce back from any adverse situations. One of the things that we have really taken on board this year at Tram House is being an emotionally available adult to our children and young people. And we can see from these examples that that means that a staff member, their presence equates to warmth and trust, and that child and young person feels safe in their presence. It means showing kindness and compassion to our young people and ultimately listening to their voice and what it is that they've got to say. Holding boundaries is also a good example of how we've shifted our practice. For example, we might say to a young person, we understand that you are angry, we understand that you're cross, or we understand that you're sad. However, it is not okay to hit us in this moment. Therefore, we are okaying the feeling, but we're holding the behavioural boundary and still continuing to set high expectations for our behaviours. Even things like the way that we present ourselves to our children and young people, making sure that we are respectful at all times, regardless of any behaviours that the children and young person might display. And another example is if a child or young person came to us with a history of being physically restrained, for example, we have implemented restraint reduction plans to reduce that ongoing trauma and to move towards a more proactive response and strategies in place rather than reactive strategies to behaviours that might challenge.
Okay, I'm going to discuss some of the strategies we've implemented in mainstream schools. The first thing we're going to talk about is capable environments, which is by McGill. And then we're going to introduce the autism friendly classroom checklist that was developed by Beyond Autism, and then discussing acceptance and commitment therapy and how that has supported with a case study. And then finally, the PERMA-V wellbeing plans. Okay, so capable environments, that includes 12 different characteristics outlined by McGill. The first being support with participation in meaningful activities. So we understand that mental health and well-being is supported when the child or young person is engaging in things that they enjoy, things that are quite meaningful for them, whether they're a young adult that's about to enter the workplace, or whether they're in EYFS exploring their environment. Going into provision of consistent and predictable environments, we're looking at making sure environments are quite routine, that if there is a change in, for example, staff members, or a preferred staff member is unavailable on a specific date or time, that there is a handover, there is information relayed, there's transparency for that child or young person. And then similarly with the way that their timetable is formulated, making sure that there is structure in place, or just enough structure with some level of novelty. The third one is around provision of choice. We understand that choice making is really important to build in that independence and also autonomy. It could be mundane choices such as what breakfast they're going to eat in the morning if they're going to breakfast clubs, or for example, their activity planners if they're in care homes, for example, how they want their week to look. And then similarly, more difficult choices or more harder choices, which might be around where they want to live, what kind of work they want to do, whether they want to access kind of training and employment. And then the support to establish and maintain relationships. So Emma touched upon the emotionally available adult. We can understand that some autistic individuals will come with some ACEs, and that might include familial breakdown. It can include breakdown in the home, which has led to them being in other settings, and therefore support staff or teachers, anyone on the kind of school site should be there to support and establish relationships if that relationship is still healthy and meaningful for that person. The next one is around support for communication. So within our services, we make sure we adopt our communication according to that young person. So whether that's using AAC devices or adapting maybe BSL Makaton signs, and even the way that we communicate with that young person, which we'll talk a little bit more into in the next slides. The next one is around positive social interaction. So as Emma mentioned, making sure that you are readily available, that you are nurturing, that you're providing that sense of available and readiness, basically. Okay, we're going into our sixth characteristic. Bear with me, I'm just gonna move on to the next one. So that is effective management and support. So do you as staff members, whether that's you as a SENCO, whether that's you as an LSA or TA, do you feel supported above to kind of put in place these kind of strategies? Is the effective and organizational context right? Are the environments conducive for not only your staff well-being, but also the young person's well-being? And then encouragement of more independent functioning. It's similar to the meaningful activities one, but we're not here with our young people forever. We're maybe transient, and therefore we need to upskill our learners, whether it's in our secondary schools, teaching them how to engage in self-help skills, or whether it's up to kind of post-19 and supporting them with finding work. We've also got personal care and health support. So are you able to identify when a learner is in pain or discomfort? Can you identify when they need that support, whether they need to be referred to a GP or a doctor, or kind of access appointments? So that would also support with mental health and well-being. We know that some of our learners aren't able to readily tell us that they need help physically, and this can impact upon mental health. Okay, our next characteristic is around mindful and skilled staff. So well done to all of you for even joining us on this Lunch and Learn. It shows that you want to kind of have some strategies in place for the people that you interact with, and therefore just making sure you are accessing those CPD opportunities, but even to the basics of understanding why behaviour happens and the functions for those behaviours. And the final one is around provision of an acceptable physical environment. So we know that when we enter work, for example, we're looking for, the setting to be really conducive for us to work. But that could include the lighting, the noise, whether we're surrounded by good environments, if that makes sense. And then that is all of the characteristics outlined by McGill, who identified that if these are in place, then an environment is capable to support an individual with learning disabilities and autism. Okay, we're going to discuss the autism friendly checklist. This is just a section of what Beyond Autism have implemented. It can include some sensory environment adaptations, but this one here specifically is around class team approaches. So I'll try not to echo some of the things that Emma's already discussed around how a person will present, but it could be things around class rules and consequences being consistent and fair. So, for example, if one learner is with, let's say, staff A, do they get the same boundaries and expectations from staff B? So making sure there is consistency there. And it can also include things as subtle as the tone of voice with which you speak to your young person, the facial expressions, and the body posture that you're kind of presenting. Okay. I'm going to go into PERMA-V. So this is a model we utilize with some of our learners. So PERMA-V is a model of well-being, and it centers on five areas with V as an additional. So P is for positive emotions. Does that child or young person experience pleasure? Do they experience happiness? E is engagement. Do they enter a state of kind of flow? Are there activities that they engage with that they seem quite immersed with and they kind of lose where they are? R is relationships. Do they feel cared for and supported by those around them? And M is meaning. So do they have meaning in their life? Do they feel that they're valuable, that they serve a purpose? And then A is achievement. Are they linked in with their goals? So this is just PERMA is only those five, and it's everything above the neck. So considering your psyche, in terms of your mental well-being. V is around vitality. So that's more of the physical. How does one eat? How does one move, expend energy? And this by Seligman is basically an indication. If these areas are kind of fulfilled, then that young person, that child or young person, will basically have good areas of well-being. So I'll discuss the case study in a little bit more detail. So we take an assessment, which is the PERMA assessment. And for this young person in this case study, we can see that in areas of connectedness and perseverance, they scored quite highly. So we used like a questionnaire. So it meant that their relationships were really, really good. Their perseverance to remain with things was good. However, you can see around engagement, it was scoring around 1.25. So what we've identified when we've put in some interventions and strategies is we start using acceptance and commitment therapy. So the first point, the first step would be around identifying the lowest facet of well-being. So for this young person, it was engagement. So that area really needed to be kind of boosted. So their ability to become immersed in activities. So what we do is we identify their values. We speak to them and ask them, really get their pupil voice. What is important to them? What things do they value? And for this young person, they expressed that learning new skills, being able to do things independently, and having fun were things that they valued. And then from there, step 3, we would identify and explain what a choice point was. So for them, they could either choose to engage with values consistent behavior, with those 3 values above, or they could engage in values inconsistent behavior. Once we've determined those, we highlight what is known as towards moves and away moves. So you've got towards moves move you towards the values you value, and away moves away from those values. So for this young person, they expressed that they should probably sign up to after school clubs to become more engaged. They should probably engage with their timetable. Whereas a value away or a move away would be the fact that they'd lay in bed, they'd just remain on their phone for prolonged hours, and they decline invites from their friends. So they were able to note those things down, and obviously our intervention would include kind of initiating those towards moves. We then formulate what's known as a PERMA wellbeing plan, and that involves the engagement section was that they were going to participate in after school club football, do more writing, do some yoga. They found that colouring with mum was quite good, and learning a new recipe at home was also supporting their mental health and well-being. So that is just one section of PERMA, the E section. I'm going to move on to Emma now.
Okay, so at Tram House School, we really pride ourselves on putting mental health and wellbeing at sort of the as a focal point for our young people, and we've implemented a range of strategies to support our children and young people to be emotionally as resilient as they possibly can be. So I'm going to talk through a few of the strategies that we've put in place. I don't have time, unfortunately, to go through everything, but this should give you just a rough idea of some of the things that we have in place and are still utilised in our school. So the first thing that I'm going to talk through is teaching hierarchies. So we believe that regardless of the needs of our pupils, our children and young people still need to learn more complex skills and coping mechanisms. For example, we know that bereavement will impact everybody at some point in their life, and we would take those bigger topics of conversation and break them down into what we would call teaching hierarchies. So on the slide in front of you, you have the red box, for example, that we've broken down into must-have skills, and these are skills that we think we feel are essential for that young person to have in order to access these higher topics. And then moving all the way up to green boxes, which are nice to have skills, and these are skills that we feel are sort of the culmination of the red, amber and yellow skills that they work through. This is quite bespoke to pupils with autism and additional needs. So if we take, for example, the self-harm column of the slide that you can see, at the very basic level, we would start to teach pupils cause and effect skills. Now, obviously, that's a skill that's normally acquired during EYFS years. However, for our pupils, it might be something that really needs to be taught intensively, even as they reach the age of 10, 11, 12. And we would also teach them some simple basic emotions so that they could start to access the concept of self-harm. Moving on to sort of like the amber level skills that we would teach. So once we've taught the rudimentary skills of cause and effect, we would then relate that specifically to like self-harm. So as you can see from the slide, if I pinch, I will get a bruise. And so for them to begin to understand that their actions have a consequence. And then starting to identify emotions that directly link to self-harm, and then also starting to think about that debrief process and about how emotions, what emotions might emerge after they've potentially engaged in self-injurious behaviours. And then if we move to sort of like the green at the top of the hierarchy, if you like, for our learners, starting to teach them about the effects that the longer term effects that self-injurious behaviour can have on their mental health and well-being, understanding how not to engage in self-injurious behaviours and developing a toolkit around that, which I'll come to in a second with one of the other strategies that we've developed. And then also having the language or having the tools or having the communication aids to be able to debrief with a safe adult after they've engaged in self-injurious behaviour, whether that is through signs or through a visual story or through being able to write a diary entry, dependent on ability level of the pupil. One of the other things that we have developed quite thoroughly at Tram House is the use of visual stories to support pupils with practical scenarios, ranging from medical visits to dentist visits to going on holiday, all the way up to more complex subjects, for example, the death of a family member, the breakdown in a relationship, moving house, and or going through puberty. Obviously, some of those things happen simultaneously as well. So we would develop a more robust social story around those scenarios.
We're very aware that we might be running out of time, so we might just skip through, or up to you with the zones of regulation. If you're unfamiliar with it, maybe look through the zones of regulation framework online.
Yeah, and I can talk quite quickly about pupil debriefs. So unfortunately, due to copyright infringement, I'm not able to show you exactly what it would look like for our pupils, but we would use a combination of widget symbols alongside the zones of regulation to support our pupils in the aftermath of any crises, whether that's a behavioural crisis or a more an episode of depression or self-interest behaviour, or so on and so forth. And just very quickly, one of the things that we developed, I guess, post-COVID was our risk assessments for our pupils. Prior to 2020, we had risk assessments that just focused predominantly on physical risk, but then for the last 4 years, we've also had emotional risks as part of our risk assessments to try and mitigate and support our pupils, again, proactively with strategies that might support their mental health and well-being.
Okay, we're going to talk briefly about the person-centered planning. So we have PCPs that will have already been sent out to you or after the presentation, but Beyond Autism utilize a person-centered plan, which highlights what is important to the individual as well as for the individual. So there are a range of sections that can be filled in and individualized accordingly, but it would basically highlight what decision making can be done with the child or young person. It could be around what a typical good day looks like for them and what supports they need in place. Our final slides are around the use of PCPs or either documents that you might have come across already. So if many of you work in hospitals, you might have things like communication profiles or hospital passports to support the child or young person entering medical appointments. We really stress the importance of interdisciplinary team working, so making sure you liaise with speech and language therapists and also occupational therapists. And if we are talking about mental health and well-being, just being able to liaise with CAMS if that's needed as well. And then finally, just signposting and referring. We know, as myself as a behavior analyst and Emma as a head of a school, we're not mental health professionals, but of course our work will sometimes deviate into those areas. But again, making sure you are accessing the mental health professionals that are well versed in these areas. So that could be from a CBT stance or kind of ACT, as we kind of alluded to a little bit earlier. So yes, and then finally, we do want to thank you for your time. In terms of the next Lunch and Learn, we have exploring challenges around sleeping, and that will be on Friday, 19th of July at 12:30 with our outreach consultant, Cynthia. If you do want to make a donation or you have feedback around this Lunch and Learn, then please scan the QR code. I am aware that in the chat there were some issues with sound for a few of the attendees, but yeah, the slides will be shared, and also the recording will be available on YouTube afterwards. So thank you for taking your time to listen to the Lunch and Learn. Have a good rest of the day. Bye bye.